Hello, everyone, and welcome back to Atlantic Coast Aesthetics. I'm Matt with ACA, and joining us once again is Dr. Thomas Pane, answering the question of the week. Dr. Pane, we have a question here on fillers. Question comes from North Palm Beach. Question is on Restylane, and this person just had some injected in her face and was told it would last for about 9 months. But contrary to what she was told, it only lasted for a week. They're wondering if working out, as they work out every day for about an hour, does this have any influence to do with the fillers disappearing? Dr. Pane, what would you suggest in this situation?
So in this one, from what I understood from the written description, was the Restylane was injected into the tear troughs, or the little grooves under the eye orbit rim there. Now that is a very tricky area to handle. And the filler doesn't last only a week. It lasts longer than that. What may have gone on here, and I can't be certain, it's possible that when it was injected, there was some soft tissue swelling around there, and that looked like it was full correction. And then as that swelling went down, it looked like the filler went away. I don't think the exercise had a lot to do with it, but in a way, I'm happier hearing that it went away without effect, rather than hearing that there were bulges or other problems in the area. Because when you use Restylane in that location, it's very tricky to get it right. So it's better not to have problems and to have it undercorrected than have some issues in most cases. There are certain fillers that are better than others for use in that region. Other options actually include transferring fat there. Not everyone does that. And for patients that have other issues in that region, sometimes the surgical options are best. So I don't believe that the Restylane went away after a week. It sounds like it was more an undercorrection. Your best option may be to have perhaps some more filler injected, maybe a different type. There are some others that work in that region. One is called Belotero. And there are other types of Restylane with very small particle sizes better in that region. So in general, undercorrection probably better than overcorrection. Sorry to hear that it didn't last, but it's worthwhile exploring some options for that region. And keep in mind, it is a tricky area to try to approach compared to a lot of other standard locations for the fillers. So I hope that helps.
Thank you, Dr. Pane. If you have a question for the doctor, please visit our Facebook page or website. Dr. Pane, we appreciate your time, and we'll see you on the next question.